As the year winds down, you might find yourself still winding through the maze of open enrollment. With the deadline knocking on our door, it's not too late to answer the call to get the insurance you need for 2024. Covered California is here to help you navigate the path to health care with peace of mind. Here to smooth out your enrollment ride is Jessica Altman, Covered California's Executive Director. Welcome, Jessica.
Thank you for having me.
Happy to have you on. So, Jessica, let's start with the three-parter that will hit us with the quick facts. What is Covered California? Who is it for? And what is open enrollment?
Great question. So Covered California is a free service offered by the state. We do two things. First, we're a marketplace, so we bring quality name brand health insurance plans and help you navigate that shop and compare process. We're also the only place in California where you can come and also receive financial assistance to help you afford the cost of those quality name brand health insurance plans. We are for any Californian who doesn't have health insurance coverage from another source or who doesn't have affordable health insurance coverage from another source. For example, if their employer coverage is too expensive for them. And now is the time, open enrollment, we're open for anyone. You don't need a reason to come in. It's the time to enroll in coverage.
All right, and how many folks in our area might be eligible for Covered California subsidies or Medi-Cal?
Yeah, so actually we estimate there are around 130,000 residents of Sacramento into the northern region, another couple tens of thousands of people in the San Joaquin Valley who are currently uninsured, yet they are eligible either for no cost or low cost coverage through Covered California or through the Medi-Cal program. So as much as we've reduced the uninsured rate in California since Covered California came to be, the Affordable Care Act, the greatest reduction of any state in the nation, we definitely still have work to do, including right here in this region.
All right, and speaking of that, let's speak about the financial side. What's the price tag for coverage and what financial help might kind of bridge that gap?
The first thing that's really important to know is there are no income limits for Covered California. No matter your situation, you can come in. It's just that our financial assistance is on a sliding scale, so the more you need, the more you get. Today, right now, 90% of the people we cover are receiving financial assistance, 2/3 of whom can find a health plan for a cost of $10 or less per month. But again, what you pay will depend on your income. This year, we have record financial assistance more than ever before, both because the federal government is continuing to provide record levels of assistance for premiums, but also the state of California has stepped up this year. Governor Newsom, the legislature, and we're launching a new program that will lower out-of-pocket costs, so that cost when you go to actually get care, including eliminating deductibles entirely. None of them, $0 for over 650,000 of our current enrollees.
Wow, I mean, I'm sure that's music to a lot of people's ears. And let's talk about deadlines because it's approaching. So when's the date for people to get their enrollment squared away?
Yeah. So if you want coverage on January 1st, you want to be covered for all of 2024, you need to enroll in December. Open enrollment does go through the end of January, but if you come in January, your coverage will start on February 1st.
Okay, and then Medi-Cal has been a hot topic, but some enrollees have faced hurdles. What's Covered California doing to help them land coverage?
Yeah, so during the pandemic, the Medi-Cal program didn't do something they normally do, which is every year recheck, are you still eligible? And as the public health emergency and the pandemic has gone away, they've been restarting that process over the course of this year. So that means the over 15 million Californians enrolled in Medi-Cal will get their eligibility rechecked. Most of them will find they're exactly where they need to be. They're still eligible, still covered on Medi-Cal. But some have had changes. Maybe their income went up and they are no longer eligible. That's where Covered California comes in. So we've been working so closely with our partners in Medi-Cal. We've launched what we call our auto enrollment program, trying to make that process as seamless as it can be if people need to go through that transition, which we know can be confusing and challenging. And thousands of Californians have already stayed covered. So if you're one of those Californians where you're worried about your Medi-Cal or know you've lost it, don't hesitate to contact Covered California.
All right, important information, Jessica. Thanks for coming on and telling our viewers all about this.
Thank you for having me again.
Yes, you can find out more by going to coveredca.com.